Intensivist. Today, I want to talk about an invisible but deadly threat to your health: air pollution. Most people know that smoking and high blood pressure can lead to heart disease, but don't know exactly how bad the risk is. Air pollution is now considered one of the top risk factors for cardiovascular, that is, heart health. According to the Global Burden of Disease study in the year 2019, air pollution caused almost 6.7 million deaths, almost two-thirds of them from heart attack and strokes. And what's the main culprit over here? It's called PM 2.5. These are tiny particles from traffic, factories, and fossil fuel combustion. That is coal, oil, natural gas. These particles are so small, less than 2.5 microns in size, that they bypass your lungs' defenses, enter the bloodstream, and trigger inflammation, which leads to high levels of free oxygen radicals, or what we call reactive oxygen species, and this eventually leads to blood pressure damage. What does this cause? Hypertension, where even a 10 micron increase in PM 2.5 raises blood pressure by 1 millimeter of mercury. Atherosclerosis, which we call narrowing of the heart blood vessels, which increases the thickness of the walls of the coronary arteries, that is the ones inside your heart, and the carotid arteries, that's the one inside your brain. The thicker the artery, the more narrow it becomes, and as a result, blood can't flow through it easily. This leading to increased risk of stroke, heart attacks, what we call arrhythmia, that is irregular heartbeat, which eventually leads to heart failure. A meta-analysis. So what's a meta-analysis? Those are many studies all combined together to make them even more powerful and more effective, showed that for every 10 micron increase in PM 2.5, there was a 2.1% increased risk of heart failure and hospitalization. And the really worrying thing is that these numbers start below what is considered safe. So in India, that is 30 microns per meter cubed, and in the US, up to 20. So even below that number, these effects start ramping up. So what do you as a layman, what can you do? You can check your AQI levels daily, especially if elderly heart disease, have lung disease. Avoid outdoor activity on days of high pollution. Wherever possible, use an N95 mask and indoor air purifiers at any time if the PM 2.5 is more than 50. And of course, talk to our politicians, talk to our leaders. We have to advocate and we have to work on getting our air clean, working, and taking up clean energies, taking up policies and technologies which help to remove 2.5 from our air, and maybe decreasing the use of transportation wherever possible. Pollution is now just an environmental issue. It is a cardiovascular, it's a heart emergency in slow motion, and this is a problem that needs to be fixed. Thank you for tuning in. Follow along for more practical science-based health advice over here at the Inquisitive Intensivist. I'm Dr. Avril Roy, and I hope to see you again in the future.